how much is it?
It will not exceed 1,000 pounds for 3 months.
You try to only eclectic patients with it?
I want to try, this is, as I told you, I will talk with the Saudi doctor. I think she will have a lot of epileptic patients.
Yeah,
I need, sure. Where? In UK?
Yeah, I'm running the diagnostic lab at the university in GS, so we have quite a lot of epileptic.
We can try. We will get the free sale certificate. Yeah, sure.
Parents are so desperate.
Yeah.
Looks like, do you think it goes better with the age?
The younger the age, the better the outcomes. No doubt. Because the growth factors are more in the younger age.
So they are stable.
The girl didn't see since December. When
I can redirect some of the patients to you.
Sure.
So we can try.
Sure. Yes, sir.
There's one.
Yes, when does the improvement stop, and is there a regression of the disease?
Expected to have regression, especially if the cause is genetic or autoimmune, because we did not stop the cause. So after we reach the stability, we will give a maintenance dose, and this is what came in my mind. That we are still new actually. These things I patented last year only. So all the patients are still in the active course. We said we will give a year, and then we will stop 3 months to see what will happen. So most probably we will need a maintenance dose for the case, especially for the cases of genetics and autoimmune.
Have you done any random controlled trials to show that there is a difference to...
We are waiting the approval of Catania University now, the ethics committee there. We registered a trial with clinicaltrials.gov, and we are waiting approval.
And is the treatment commercially available now or not yet?
Yes.
It is?
Yes.
Approved?
Free cell certificate I got, yes.
Yeah.
I was going to actually reiterate about the regression. You showed eloquently about the cities which were devastated, irrespective of the means. However, the problem still remains that these patients obviously have not spontaneously, all of a sudden, that all of the cells have cross-communicated and decided to degenerate. So therefore, there's some sort of stimulant for the degeneration of these neurological cells.
Yes,
and so because of that, how do you know that even that these patients, as with chemotherapy, may not then become refractory to this type of treatment? Whether, you know, I think it's very promising, but at the moment I think there's a lot of unknowns, at least from this, about is it patient specific? We deal with Parkinson's patients, and I know from what I've seen with our physicians, by just being allowed to attend their clinics, these patients have good days and they have bad days with respect to their conditions. So it's about bringing some kind of information to what the professor over there was saying about, you know, blinded studies and what is the real clinical impact.
Look, sir, this treatment, first of all, this is a supplement. I don't call it treatment. And I'm not creating for it any claim except improving the mental health, improving the regeneration of the brain cells. This is my claim for this medicine. Till you do your job by making for me the database of the genes and by proving me the informatics, and I know what is the gene responsible for each disease, and I know how to kill this gene so that I have a definite treatment, I have nothing in my hand to my patient except to help him to regenerate. As I told you in the lecture, ALS has nothing to give to the patient except write your will, tell your last prayer. When they improve in this way,
quality of life. I mean, here, I mean, what is the sort of real long-term improvement that you're giving these patients?
We are studying. We are just 6 months. This is only the result of the first 6 months of the treatment. We are studying. We are continuing the study, and the clinical trial which will come is we are putting it time for 5 years, not 1 or 2 months. We are putting 5 years to study the long-term effect of the medication with the patient. Will the patient be able to drive again? And we had a case of MS in Lebanon. The patient drives today and he's back to his work. I had a patient with retinitis pigmentosa. When I give him the one for the eye, they are able to go back to work and they can put glasses and they can read. What will happen with the neurological patient? Neurological patients are more complicated. Brain is more complicated and sophisticated than the retina, than the kidney, the liver. All of this is easy in comparison to the brain. Brain need longer term study. I need to see what will happen, but I cannot wait to leave people die till we know what is going on. This is the concept.
Okay.
So this is what I'm telling you. I'm waiting you. Yeah, your work is very important in few years' time.
The last time, please.
I don't know what evidence you have, because you talk about degeneration and regeneration of nerve cells. That to me is a very difficult concept to comprehend, because I've never seen regeneration except in some zones of the brain that have nothing to do with the price of bread. So when you say the cells have degenerated and then there is a regeneration of the cells, what proof do you have of that? And as an example, I take Parkinson's disease, where there is a loss of dopamine in the nigrostriatal cells to the caudate nucleus, okay? And the patients are immobile, they can't move, they can't do anything. But when you give them L-Dopa and a dopa decarboxylase inhibitor, they get up and they can even dance.
Yes.
The cells have not degenerated. They are simply damaged, if you could use that word. And by giving the L-Dopa, the dopamine precursor, you stimulate them again, and they get dopamine, and they are able to stimulate the caudate nucleus. So
This is
the
the
evidence
dopamine
has to be there.
Listen, this is the dopamine. Dopamine should be released. It's not released anymore from the cells. There is a cause. We didn't know the cause yet. So instead of giving the dopamine and increasing the dose, I saw the cases of dopamine in the hospital. We reach the maximum dose, and then we say to the patient, die in peace. If we can make the dose half by helping the body regenerate its own dopamine, this is, in my eye, for Parkinsonism, this is great achievement. I'm decreasing the dose so that I'm giving the patient more time till we discover what's going on, till we are able to solve it completely. So if it is deficiency like this is an exact example for the dopamine deficiency in Parkinsonism. Something deficient in our body. Today we are giving the dopamine. I don't want to give the dopamine. I want the body to make its own dopamine according to its need, because the dopamine I will give. I reach the maximum dose, I cannot give anymore. And this is what's happening. We wean the patients to come back to the half dose, and then we start to increase the dose again. So they are ups and downs. The life of the Parkinson patient is up and down, up and down. This is what I want to reach. I am helping the body to create this here in the level of neurology. But we have more serious level in endocrinology. Testosterone deficiency syndrome, growth hormone deficiency syndrome, menopause. All of these we are giving today what? Hormones. All hormones make cancer. Even the thyroxine increase to 2,000 folds the breast cancer. I want to help the body to make its own thyroxine. I want to help the body to make its own dopamine. What made the cell does not secrete dopamine? Degenerated, affected, we still don't know.
No, but if the cells were degenerated, I mean, maybe I'm stupid and I'm not getting it. But if the cells were degenerated and you give L-Dopa and a dopa decarboxylase inhibitor, you're not going to regenerate the cells. They're not going to go anywhere. The cells in the substantia nigra cannot be degenerated if the patient improves with L-Dopa and a decarboxylase inhibitor.
There are three pathways for the
point.
dopamine.
What is the evidence? That's what I'm asking. What is the evidence that the cells for the ALS have degenerated? Maybe they haven't.
No, there are lots of evidence there. There are lots of evidences in the literature. It's full of evidence about the ALS, and even its definition. It is degeneration of the neurons supply the skeletal muscles. The smooth muscles are spared. sphincters are spared. So as long as this is the definition, definition is degeneration in the textbooks. It's not my definition. Regeneration of the nerve cells. Also, the proof of evidence is lots of studies about the proof of evidence of regenerating all the tissues. Actually, we have one folder. If you want, I can give it to you as a reference. More than 300 studies about regeneration of all the types of tissue in the body.
Okay.
But
That is
I don't want to.
We can
I don't
discuss
want to delay
Time
this.
is full, please.
I know. I don't want to delay this, but okay, the textbooks say that the nerve cells related to ALS are degenerated. Okay? So, what is the evidence that you are regenerating these cells? Because you say they're degenerated and will regenerate. That's really
How the muscle started to work again.
Huh?
How the muscle started to work again.
Yes.
How? The muscle was wasted
that's
because
my
of the
question.
degeneration of the nerve cell.
That's my question.
It started to work again. It will not work without nerve cell, so the nerve cell is regenerated.
So is there a possibility that the nerve cells have not degenerated? That's my question. And you're
Possibility they are not regenerated?
You're simply giving dopamine to the substantia nigra, for example.
I have the analysis of my fluid.
Huh?
I have the analysis.
Yes, sir. Okay.
There is analysis for the fluid that there is nothing except bioactive peptides.
Yes, so let's thank you very much for
Yeah.
the
Tomorrow we have another session, maybe we can discuss more.